Isaac is a 65-year-old retired teacher who's noticed some changes in his memory during the past year. Specifically, an increase in forgetting names and recent conversations. Over the past several months, his wife's noticed he's required frequent reminders for scheduled events. He's also missed several bill payments in the past year. He currently drives, and neither he nor his wife have any concerns about his driving, with no reported collisions or near collisions. However, Isaac recalls when his own father began to have challenges driving safely and wants to speak with his doctor about his memory changes in order to be sure he can maintain his independence as he grows older. Driving is a complex task that involves many different skills and body functions. For many, driving is important for maintaining social contact and participating in activities that they enjoy. To drive safely, we need to integrate our visual, cognitive, physical, and perceptual skills. As people age, they're more likely to develop health conditions that impair these skills, and this may negatively affect their driving ability. Of particular concern is the subgroup of drivers who may not recognize their declining abilities due to cognitive impairment. In Ontario alone, the number of drivers living with dementia is expected to double in the next few years, reaching 100,000 by the year 2028. As a result, it will be important to assess those who may not recognize that they're having problems. Licensing bodies are focusing on developing better ways of screening drivers. These screening tests will serve to flag those with cognitive problems who may be medically unfit to drive. However, there's currently no single test that has been developed that can determine if a driver is cognitively unfit to drive. We've asked Dr. Brenda Vrkljan to talk about how cognitive decline can impact a person's ability to drive safely and how healthcare professionals can help evaluate a person's fitness to drive and support them in maintaining their mobility and independence for as long as possible. Dr. Vrkljan is a professor in the School of Rehabilitation Science at McMaster University and a trained occupational therapist. She's passionate about promoting safe and functional mobility across a person's lifespan, which is evident in her research in the Can Drive initiative, a study that focuses on older adults and driving patterns.
It's great to have you, Brenda. Can you talk a bit about the evidence that links performance on some of these assessment tools and cognitive assessment tools like the clock drawing test with medical fitness to drive in older adults specifically?
Yeah, so Anthony, first thing I just want to say is what a challenging issue determining medical risk to drive can be at any point in our driving lifespan is what I'll refer to that as in terms of being age 16 and older, because really we can experience a medical change at any point in our lives that could impact our ability to operate a motor vehicle. And so it's really important as healthcare professionals that we consider the importance of driving in people's lives, the impact it could have on their ability to do out-of-home activities, and to be able to access the places that are important to them. And so in later life, we know that you may be more likely to experience a health-related change that's significant, that can impact your ability to think, what we refer to as cognition, our thinking skills. And so when a health condition, and oftentimes people think of dementia, not surprisingly, Anthony. And so when we think of dementia, we think of the impact it can have on our memory. But in fact, dementia can have impact on the way we process information in our environment, and our ability to remember things, obviously, which I just said, as well as our communication skills, our word finding skills, and eventually perhaps our ability to get dressed in the morning and perform our activities of daily living. And so driving is a really complex skill It requires vision. It requires our thinking skills. It requires that coordination with our motor abilities or our ability to move physically. And some people refer to it as sort of that super activity of daily living because it requires so many things. So when we decide to pull out, and I say the proverbial we as an occupational therapist, and we decide to pull out an assessment tool like clock drawing, the clock drawing test, it's because we have or we've seen or observed or heard even the client or patient report that they're having some changes that could impact. And so we have to set up that conversation very carefully. But all that to say that the clock drawing test is one of many tests that can be used to look at how we process information in our environment. And as an occupational therapist, I'm thinking about what is the impact this is going to have on people's daily lives and their driving. And so with the clock drawing test, people say, well, what does a clock have to do with driving a car? And when we actually break down that task, our ability to copy information, visually process, listen to instructions, sort of that visual spatial ability where things sort of sit in space. And that sounds all very complex, but in fact, our brains do that every day in all kinds of ways. Even when I'm talking to you right now, there's all kinds of information that I'm able to process and pick up. And so we want to make sure, not surprisingly, when people are in their cars and behind the wheel, that they're processing information adequately. And we don't take that conversation or that decision to pull out a test like clock drawing lightly.
Can you talk about the way in which cognitive decline can impact driving?
Yeah, so cognitive decline is like a challenging concept when we think about it, right? And so when we're talking about cognition, again, we're talking about those thinking skills, right? Attention, our ability to process information, to be able to decide if we're going to make a decision or not, which is the irony. And a lot of that's done in an unconscious way during skills like driving, which become highly rote in some ways, that we're able to do them sort of automatically, many of the maneuvers, because we've done them oftentimes, particularly for older drivers, for a long time. And so with cognitive decline, what can happen is we may not be processing information in our environment in the same way. And so we might miss things, important things in our environment. And some people say, well, I always drive the same route. I always drive from my house to the grocery store, for example. But we know, in fact, even in that environment, that things can change, that you can have a pedestrian that wasn't there yesterday, that you can add weather in this lovely climate that we have here in Canada, the lighting, right, that can change. And that can change how we visually process information, which again can be affected by cognitive decline. So it's a really complex condition. And that's why we do need to work with other healthcare professionals as well to understand what the staging of the diagnosis, with health professionals like yourself, Anthony, who's you're a psychiatrist, right? So really important to help that person, get not only diagnosed, but understand where they are in that condition. Because people with cognitive decline early can often still perform many of their daily activities just as they would. And that's really important. So just because you're experiencing cognitive decline does not mean that you cannot drive. And so that's why, people like occupational therapists who work specifically on looking at activities of daily living or occupations of daily life, like driving, want to see how you're doing on some of those tests that we talked about, those assessment tools like clock drawing, like your ability to dress yourself, like your, and if needed, there are occupational therapists that are involved in that on-road evaluation if necessary. And that's because it's a medical concern has been identified, and that's very different from a ministry road test. So all of that to say that cognitive decline is complex, and depending on where you are in that decline, whether that impacts driving or not, needs to be considered, let alone amongst other activities of daily living.
So let's say a health professional is concerned. You mentioned the clock drawing test, but what are some of the other assessments that professionals might do if they were concerned about cognition and the patient's medical fitness to drive?
Yeah, so it's a complex one, right? But if it's been raised in, that it's related to changes in thinking skills, then this is where it's so important, right? It really starts as per usual with a conversation. So it's not only just pulling out, and I'm going to say again, tests like the clock drawing test, and there's a number of tests that will sometimes be used by healthcare professionals, but it's important to have a conversation. So asking you questions about your driving, whether that's change, whether you've noticed changes. And with your permission, sometimes we'll talk to family members as well, but you're part of that dialogue. We want to make sure that everybody's included in these conversations because it is an important one. We know sometimes it can be hard because sometimes we don't have, if we're experiencing cognitive decline, we'll say that we don't always have the insight, right? And what that means is we don't realize the changes that we're experiencing that are impacting our day-to-day life. And so sometimes somebody might be saying something that you disagree with because you're just not aware of those changes. So that's hard, but we want to have that conversation. So I will say interviewing becomes a really important part, understanding your circumstances, where you live, how long you've been driving, whether you've had some changes, as I've said, in your driving record, perhaps, whether you've experienced a crash. And of course, that's you telling me. That's not me, going and speaking to the ministry. I'm interested in your perspective as the client or patient. And then, of course, as we talked about, we may or may not pull out, some other assessment tools to see how your thinking skills, how you perform on different things. But we have to think about those circumstances as well, because if you're highly anxious about those circumstances, you haven't done anything like this in a long time, we want to make sure that you can hear the instructions. So you're hearing, we want to make sure you have your hearing aids. When did you have your glasses last updated? There's just so many things that are important for us to think about when we're having a conversation about driving and cognitive decline. Mood, right, for example, can also have a major impact on people's performance and thinking skills. And if people, are experiencing depression or social isolation, how they perform when you ask questions or give them a test like clock drawing actually could be impacted by those issues as well. So it's, again, not a straightforward answer, but we're very thoughtful, I will say, as healthcare professionals about when and how we use the tools that we do.
Yeah, I would totally agree. You're looking at the big picture as well. You're not throwing everything into one assessment test. And there's a lot of different factors that play into the overall assessment of medical fitness to drive. So somebody could be completely cognitively intact, but may have other medical conditions that might put them at risk, something like poorly controlled seizures, for example, or even the medications that might be used to manage some of the conditions. If they are impacting somebody's awareness or causing sedation, they may also constitute some of the reasons why somebody could be medically unfit. And I think, as you've said before, it's about the health. It's not about the person's age. Older drivers may be excellent drivers, and younger adults may have issues that make them medically unfit.
That's right. So we could experience, just as you said, a health-related issue that could impact our driving age 16 and onwards if we've received our license in that traditional way, which we also know that people getting their licenses is actually delayed now as well. But driving is still the primary way we get around. It's the most convenient way, and so it does often sit prominently in terms of people being able to do the things that are important to them.
So what are some of the signs that somebody should maybe consider stopping driving, which is a process that we sometimes talk about, driver cessation?
Yeah, so I think sometimes as we get in later life, our family may have conversations with us if they have concerns. But how do I know that maybe I'm not as comfortable as I once was behind the wheel? And it's not age. So it's the first thing I want to say is just because you're 75 does not mean now that you need to think about giving up your license. I think that is a really important message. But rather, some of the conversations you heard me just talk about comfort. So it's one of the things you might notice is I'm not as comfortable in certain situations as I once was. So busy parking lots, for example, can be tough, can become a little bit more challenging. It might be something that we notice that we're not feeling as comfortable negotiating that, let alone driving at higher speeds, driving at night. And those are sometimes some of the early signs. And with some declines in our, physical functioning, and I'll say health conditions is actually, we're not able to visually process information as much or as easily because of changes in our body system, our body functions around our eyes. So sometimes actually accommodating or adapting our driving in that way, right? To say, actually, I'm not going to drive at night. It can be a really, really important and good decision. But some of our really important activities are at night, Anthony, right? The grandson's hockey game or my friends are hosting a bridge game and I want to go out. So when people say, I don't drive at night, we know from our research that in fact, people do drive at all times of the day in all kinds of weather. And that's not because they don't have the insight, it's because they have places to go that are important to them. So I think, this idea of people honking at you more perhaps, and you might just hear honking and you might not even realize it's you, but that's something that sometimes people pay attention to. If you've had some near misses, or even, unfortunately, it wasn't a near miss, but you've hit another car or have crashed, that's a concern and often we'll say a red flag, right? In terms of, you might want to think about whether driving has become a medical issue, or a medical issue is compromising your ability to do that. So again, age, not a factor, neither's gender is not a factor, but I think this notion of some medical changes. Obviously, we can experience sudden changes. Unfortunately, a stroke or something like that can come on very suddenly, and that can result in changes. But that's not necessarily, again, a reason or you'll be told to stop driving, because there's lots of follow-up that has to happen, and also lots of changes we can make to your car to enable you to be able to drive. But the key is whether you have the insight or the ability, right, to realize that perhaps driving is an issue and that you require some additional aids to help you do that. But I think healthcare professionals have a really important role to help support people in their mobility, and that includes driving and all the other ways we get around.
You mentioned just how important driving is to mobility. What are some of the downsides to stopping driving? Are there any big concerns from that standpoint?
Yeah. So what the research tells us as well, that actually when people when older adults stop driving, it can actually lead to earlier death, admission to a long-term care facility. And obviously it's more complex in terms of the relationship to that. But if I just gave an example that, somebody's unable to drive anymore, well, then they're not likely participating as much. If they're still in their home, if that's the case, then they may not be participating as much and going out as much, thereby not moving around as much, Anthony, in there, right? And when we think about walking and all the things that we need to do to be able to, or what we do, interacting with other people, those kinds of things. So when we're not moving around as much, we know that the body doesn't really like that, does it? Usually, and there's some negative consequences to that. So the other thing is, not being able to drive again. We talked about this notion of social isolation, right? And even people will say, well, I go to Tim Hortons and yes, I have a coffee. I don't always necessarily talk to anybody. Well, actually you are talking to people. You're sometimes standing in line, talking to the server, those kinds of things. And so if you're unable to do some of those some of those daily tasks that you once enjoyed. You're probably not surprised to hear that mood, decline in mood in terms of depression, out of home activity declines, isolation, and it goes on. So we've had many conversations with older adults who identify losing their license as the equivalent of a cancer diagnosis. They describe it as drawing a black day in their calendar, in the calendar of life. I'll say it has such a significant impact in terms of people's ability to do the things that are important to them, and then consequently some of the other health issues that can come up. But I think the key is to have these conversations early, right? To start thinking about what if I can't drive anymore? And as I said, this could be, this could impact me as well, right? In terms of if I experience a health-related change. Of course, I don't want that to happen, obviously, but how would I get around if that was the case? And so that can mean having to think ahead and plan ahead about ways to get around your environment. So people will actually use taxis and start to establish a relationship with a taxi service, and even sometimes a driver, where they're able, and that becomes a relationship, right? A trusted relationship, or they sign up for a service. And in fact, when people calculate, right, the cost of owning a car, insurance, I'm going to add gas prices to this conversation. Well, you're not surprised to hear that it's actually cheaper, considering how often they're going out. And then some of the pluses of not having to clean off their car in the winter. People are pretty excited about that. Car maintenance, all those things. And so there are options, but we have to plan ahead. And that's where sometimes getting the help of a healthcare professional beyond, sometimes a healthcare professional like an occupational therapist can help. Family members, it's hard sometimes, right? You feel like a burden. The family member may not have the same availability either, but we do our best, right? Friends and family can help us navigate, but we have to think that some of the downsides is that we're relying on somebody else to help us get around. But some people, we might be surprised, are actually happy, right, to do that, to come pick up and do different things. But the point is to start having a plan.
I'm wondering too if there's some pretty big differences potentially between people who live in rural or suburban settings versus those who might already live in an urban center with perhaps better access to public transit or things that are more easily walkable.
I'm really glad you brought up because it brought up the notion of geographic location. And in some of our studies, and in fact, recent studies that I've done with colleagues in geography, we interviewed specifically older adults from rural areas. And you're not surprised to hear total dependence on the personal automobile as a way to access the doctor's appointments, right? Going and doing things to maintain health, right? For walks, those kinds of things. And we know in the rural area, it's not really set up for walking along a road necessarily, right? Or for using other patterns. So sometimes that's the hard part here, is that driving means also, or losing a license may mean having to move and think about that as well, which is also hard. So that's why we do need to be thinking ahead. But does that mean that people can't live in rural areas where they want to age in place, in their place of choice? It just means that we have to think about other options. Taking the bus is not a solution, right? That could mean that put people at higher risk of falls if they have problems with their mobility in terms of walking. So we just have to carefully think about solutions. And sometimes we talk about personalized medicine in terms of medications, but it's sort of the personalized solutions, right? To have those conversations, think about people's personal activities, and then develop solutions that fit them. Of course, non-pharmacological, which means these are not medical solutions, but these are often, the way we set up our environment to support mobility.